Assalamualaikum warahmatullahi wabarakatuh. My name is Ummi Karsarina, and I would like to talk about why some people commit social deviance during COVID-19 pandemic. So, what is social deviance? Social deviance is a failure to act according what is expected by the society. So, first situation will be panic buying issue. I would like to talk about panic buying state in Australia, where people there stockpiling toilet paper roll, and when they are somehow committed social deviance because they are demanding the same thing. So even though there is an official guidance, which is they only need to practice good hygiene and social distancing, it means that they need to focus on buying things like hand wash, hand sanitizer, and also face mask, but still they are focusing on the toilet paper roll. In Sydney, which is the nation's biggest city, the supermarket shelves have been cleared in minutes. It shows that the panic buying state there is quite crazy. There are reports saying knife was pulled out in an argument between panic buying shoppers as they are demanding the same thing, and some people stole blue paper roll of public toilet. So why they act like this? Why they tend to buy all things in an enormous amount? So I would like to relate fraud theory, which is situational, for a situation where people started to feel panic and buy all these things abruptly in an enormous amount. So why? Because of ages of socialization itself, the society, the social media, there, and also the mass, social mass such as radio and television somehow enforce them to disobey the authorities' order to stop panic buying. And they tend to buy all the paper roll even though the authority has stated that there will be no shortage regarding daily necessities, especially when it comes to toilet paper roll itself. And then there are many preventive measures that has already been taken in order to contain this virus. Other than that, I would like to talk about the social deviance that are being committed by some people there, and I would like to relate it with Zimbardo theory, which is situational, as they commit as the situation where they somehow feel tense and they maybe face fear of missing out, and they don't have any option. They just choose to commit social deviance, and that's the reason why. So let's move on to the second situation, which is people disobey in MCO, which is movement control order. I would like to talk about movement control order in Malaysia, where consultant cardiologist, which is also known as Dr. Ong, he disobeyed government MCO as he joked around City Park at Georgetown, Pulau Pinang, and questioned Penang Island City Council and forces regarding the MCO order, as he stated if the government and its officer aware of what is actually MCO. As he stated, MCO is all about social distancing and also about trying to prevent coronavirus from getting worse. It's not about being shut indoor, means like you need to stay at home. But somehow, in order to make MCO successful, there must be a backup plan, such as the action to lock ourselves indoors. Because when we lock ourselves indoors, just like what the government has already been doing right now, we could avoid the risk of getting infected by others who has already been infected by coronavirus disease. And also we could it enables ourselves to identify if our close contact, such as family, has any symptoms regarding the disease. So in order to make MCO being successful, we need a we need an effective steps, and that is one of the steps that is being conducted by the government right now. And even though there is sanctions on individual, if individual disobey MCO, still Dr. Ong reject the idea of being indoor, and he joke around the park, and it shows that it somehow tally with Merton theory regarding rebellion mode, as he rejected the he rejected both means and hard work. It means that he rejected the idea, he comes up with new idea, and he comes up with new action. So other than that, I would like to relate it with Merton theory, which is destructive behavior, because it shows that he is quite selfish. Even though he has a he is a doctor, it doesn't mean that he is it doesn't mean that all of his opinions will be true. Yes, it is quite true that MCO is all about social distancing, and about MCO is all about social distancing, but MCO also is about you are you are only required to go out if there is a necessary things. It means we need to omit all the unnecessary things, all the unnecessary doings. Like just like the situation that he mentioned, that he got reprimanded by an officer there because he jogged there. It means it supposedly be their responsibility to do so, because um, he jogged around without any necessary intention. So it against the MCO principle actually. So yeah, it's quite related to both Merton's theory. And last, I would like to talk about why it also related to Freud theory, which is against moral principle and conscience. It means that he thinks that the MCO orders that is being directed by the government regarding social distancing itself, and also being indoor to lower the risk of getting infected against its principle of social distancing is about you just need to stay away from gatherings, and that's it. Yeah. So let's move on to the third situation, which is abusing frontliners because of stigma. I would like to talk about this kind of abusing happened in Philippines, where there is a hospital janitor was being bullied as five men confronted confronted him and poured bleach on his face while he was on his way to work. While in Cebu City, a nurse had chlorine thrown at him. They are being bashed on social media as they are being slandered as those who carried coronavirus everywhere and spread it to everyone. And they are also being physical assault and are being threatened to not go out from home, to not go to work. For example, some medical workers were being fined at checkpoints for breaching lockdown laws or being refused transport and laundry services. Some even being isolated in a room by their own family. Some expressed that they felt insulted because they are not sick, and they followed the disinfection disinfection guide because they are the frontliners. So it is a part of their responsibility to take care of themselves so that they could help to cure those people who has already been infected. So why is this happening? I would like to relate it with Merton theory, which is destructive behavior, as those people are being selfish, as they insist on put a blame on them, even though they are taking the right preventive measures, Other than that, I would like to relate it with 7 social processes that grease the slippery slope of evil by Stanford, which is dehumanization of others and diffusion of personal responsibility. Dehumanization of others because they somehow treat the frontliners like other things, which is the enemies, which is the coronavirus, not like a human being. So they are harassing them in many ways. And diffusion of personal responsibility as they simply transfer their responsibility to other people, which is the frontliner, but they don't take account of their responsibility to treat frontliners in a good way to lower the risk of frontliners getting affected in physically and mentally state and well-being. So these 3 situations that happens during pandemic COVID-19 must be prevented in order to ensure that the coronavirus disease could vanish. So thank you.